After completing a full facial treatment,
we have three sections:
we can also
face,
address
body,
the needs of
and
clients
body.
who
The
want
main
to
difference
achieve
between them
skin
is the
whitening.
maximum
We can
depth. For
apply
the face, the
materials
maximum
such as
depth
lactic acid,
is
tranexamic
0,
acid,
while for the body,
glutathione,
it can reach
or
a depth
other
of 3.
appearing agents like growth factors. It's crucial to use sterile medical-grade
We
materials
also
for
have two
medical
modes,
purposes.
manual and
And
automatic. So
we
what's
can
the
apply a
difference
face
between
mask
them? In manual
to
mode,
enhance
when we
post-treatment
click the start
comfort
button,
and
the
expedite
needle
the
will come out,
fading of redness.
regardless of whether we
We can
tighten skin or
refrigerate
not.
the face
This is the
mask
mode we commonly
before
use.
applying it. It's
On
important
the other
to
hand, in
use
automatic
a
mode,
sterile
the needle will not
medical-grade
come out when
mask
we click the start
and
button.
avoid using
However,
regular
if we
masks.
tighten the skin,
During
the
the
needle
mask
will automatically come out.
application, we can explain
Now,
the
let's say we
post-treatment
tighten the negative
precautions to
pressure
the
tube
client.
to indicate
For
that the
example,
skin is
they should
tightened.
not
We
wear
can see
makeup
that the
for 3
needle will
days,
automatically come
and
out.
sunscreen should
But in
only
this
be
automatic
applied
mode,
after 3 years.
you don't need to use the start button. It is more suitable for
But in the first
areas with
24
more
hours,
bones, such as
they
the
should
forehead and
refrain from
chin,
exposing their
which
face
are
to
thinner
tap water.
and
If they
uneven.
need to
This
wash their
prevents the
face
needle
within
from
3 days,
accidentally
they can
poking
use
bones
saline
when the
solution
skin is
for
not
wiping.
tightened. For example,
It
the
is
back of our
advised not
hand
to touch
has
the
many
face with
thin blood
unwashed
vessels.
hands
In
within the
automatic
first
mode,
24 hours,
it will always
as there
tighten
might
the
still be
skin first
bacteria present.
before the
If
needle
they don't
comes
have
out,
disinfected
ensuring
hands,
safety.
they can
Now,
use
the
medical
peptide
masks for
represents the
5
needles for
consecutive
this treatment,
days to
and the
replenish
number represents the
nutrients,
treatment
which will
time,
enhance
which we can adjust.
absorption.
For example,
Within
for
the first
facial
3
treatment,
days after
it
the
usually
treatment,
takes about
they
20
should
minutes.
avoid alcohol consumption
But we
and
can adjust it
strenuous
accordingly.
activities that
If
cause
the time is
excessive
up,
sweating.
we can simply increase the time. As for the
We have already
depth,
informed
when
the
we do a
clients
full
about
face
these
treatment,
specific
such as
post-treatment
around the eyes
instructions
or forehead,
when they
we
sign
need
the
to reduce the
informed
depth
consent
accordingly.
form.
For areas with
After the
large
face mask
pores or
treatment,
scars,
we can
we
apply
need to increase the
erythromycin
depth
ointment.
accordingly.
The primary purpose of
These
erythromycin
specific
ointment is
parameters
to
can be
prevent
adjusted
infection.
according to the
Clients
parameter
can apply the
recommendation
ointment on the
table.
same day,
This speed
and from the second day
represents
onwards, they
the
can
speed
apply
at which
growth
the needle
factors in the
comes out.
morning and
The
evening
larger
to
the time
promote wound
adjustment,
healing and
the
collagen
slower the needle
regeneration.
comes out, indicating a longer energy output time. For example, for deep acne scars or large pores, we can increase this time to allow the needle to stay in the skin for a longer period, resulting in a longer energy output time. However, if there is no major issue and the goal is just to improve skin texture, we can shorten this time. With a shorter time, the needle will return to its original position faster, resulting in less pain. The negative pressure value indicates the suction power, and we don't recommend adjusting it too high. Post-treatment redness may be more noticeable. Generally, setting it to 1 is sufficient. Lastly, the RF energy represents the energy level, which we adjust based on the condition of the skin lesion. We usually start with 64 skin test and gradually increase it. So, for specific parameters, we can adjust them according to the parameter recommendation table. Let's introduce the different treatment heads we have. We offer a total of 4 treatment heads. The first one has 25 needles and is primarily used for facial treatments, targeting specific areas such as around the nose, eyes, and individual wrinkles like stretch marks, crow's feet, and scars with similar shapes. It's also suitable for treating scars on the hands. The second one has 64 needles and is mainly used for body treatments, including the use of negative pressure tubes for abdominal treatments. The coverage areas are quite different. For instance, it can also be used for facial treatments if the customer has a larger face. The third one is needleless and is used to enhance product absorption. It's a great option for customers who cannot tolerate needle treatments. First, the product is applied to the face, and then it is used to raise the skin temperature and promote product absorption. Let's introduce the materials to be prepared before operation. Iodophor, normal saline, medical sterile, disposable cotton swabs, erythromycin ointment, epidermal anesthetic, medical mask, facial cleanser. The operation process of makeup removal product, the first step is to remove makeup and clean the skin. The second step is to take pre-operative photos and determine the treatment site. We need to sign the informed consent form, exclude contraindications, and inform the customer of some problems and precautions that may occur afterwards. Then we will take off the metal ornaments on our bodies because we are made radiofrequency cars. And next, we will apply epidermal anesthetic. After applying, We can apply plastic wrap to make it absorb better. The time we need for anesthetic is about 20 to 30 minutes.
Okay, when the anesthetic time is up, we will scrape off the anesthetic and clean it frequently.
If there is a lot of hair on the operating site, we recommend shaving it off first, so that the skin reaction and energy penetration can be better observed.
Using sterile gloves for skin disinfection. We disinfect the skin with iodine, wiping it twice, and then use saline to remove the iodine, ensuring thorough disinfection. This is crucial because our treatment is invasive, requiring a sterile operation. Afterward, we apply saline. Why? It's important to wipe off all the iodine and disinfect the interface, as we need to adjust parameters and come into contact with it, including the handle, which also needs to be disinfected. Before each operation, it's best to soak the negative pressure tube in alcohol, as the side of the negative pressure tube will also touch our skin during the process, requiring thorough disinfection. Then we proceed with the needle installation. There are 2 buckle positions on the needle, which we align and rotate to install the negative pressure tube. And then it's off. You got?
Okay.
After that, we will adjust the parameters according to the parameter suggestion table before doing so, and first test whether the needle is normal. After the test is normal, we will give the customer the operation to demonstrate the operation method. First of all, we will conduct a skin test before this treatment. If we do skin test, we can choose a position on the side that does not affect the beauty. Then the needle must be vertically close to the skin. Can't pry open like this, must be vertically close. Okay, we're doing a skin test here. At first, before we start, we have to tell the customer to prepare him psychologically. Then we can make 2 copies and wait for 3 to 5 minutes to observe the skin reaction, because the skin has substantial red classes. If there is mild edema, it is normal. Well, if it is a place with abundant capillaries, it is normal to have a slight increase in bleeding. Then the position he has just hit in this area is slightly red. That is okay. If the client feels that he can accept this energy and will not say that it is very painful, then we can use this energy for formal treatment. If redness is obvious and the customer feels very painful, then we have to reduce energy. If it is not red at all, then we have to increase our energy. Then when doing the skin test, for example, after we finish the first shot, when you find that you do not have the reaction you want, then we will continue to do the skin test. We can't repeat the skin test in one place. We have to change the position. We can officially treat you after you are. Then the face is mainly from bottom to top, from inside to outside stamped, type treatment head close to the skin. Cannot pry open. Between each round, we can overlap by 10 to 20%. From bottom to top, you operate out. Then in the process of doing it, we will ask the customer how he feels and observe the skin reaction. Around the eyes and around the cheekbone, we need to lower the depth a little bit and adjust the energy a little bit.
Recommend 0, 5, 1, 0 for IV. 0, 8, then this video has 50 energy.
It is also when you are below. We can pull his skin down with our hands, and there will be more positions to do this. If there are some customers around the eyes, for example, where there are crow's feet and wrinkles around the eyes, we must use our hands to spread the wrinkles first. After opening it with your hands, we will compete again. It will be better if the energy penetrates into the wrinkles. If some customers have a lot of wrinkles around their eyes, we can also change the needle of this hour hand to strengthen the wrinkles locally after making a complete face. Then we suggest not to operate the eyelids, because the eyelids are very thin. If it is an operation, we can put eye movement in advance, or adjust the depth to below 0. 5, and the radio frequency should be as low as possible, so we can do it. However, in general, we do not recommend operating the whole face of eye. After the operation, we can strengthen it once or twice in some positions with large pores, or in positions with obvious pockmarks, scars, and wrinkles. And we try not to do more than 3 times so we can strengthen it in the position with large pores. Chimol.
After completing a full facial treatment, we can also address the needs of clients who want to achieve skin whitening. We can apply materials such as lactic acid, tranexamic acid, glutathione, or other repairing agents like growth factors. It is crucial to use sterile medical grade materials for medical purposes. Then, we can apply a face mask to enhance post-treatment comfort and expedite the fading of redness. We can refrigerate the face mask before applying it. It's important to use a sterile medical grade mask and avoid using regular masks. During the mask application, we can explain the post-treatment precautions to the clients. For example, they should not wear makeup for 3 days, and sunscreen should only be applied after 3 years. Within the first 24 hours, they should refrain from exposing their face to tap water. If they need to wash their face within 3 days, they can use saline solution for wiping. It is advised not to touch the face with unwashed hands within the first 24 hours, as there might still be bacteria present. If they don't have disinfected hands, they can use medical masks for 5 consecutive days to replenish nutrients, which will enhance absorption. Within the first 3 days after the treatment, they should avoid alcohol consumption and strenuous activities that cause excessive sweating. We have already informed the clients about these specific post-treatment instructions when they sign the informed consent form. After the face mask treatment, we can apply erythromycin ointment. The primary purpose of erythromycin ointment is to prevent infection. Clients can apply the ointment on the same day, and from the 2nd day onwards, they can apply growth factors in the morning and evening to promote wound healing and collagen regeneration.